Hi everyone, we're visiting now with Dr. William Kurtz, who is the Chief of Orthopedics with St. Thomas Midtown, and he's also affiliated with Tennessee Orthopedic Alliance. We welcome you to the program.
Thank you for having me.
Yeah, thanks for visiting with us. We're talking about something that affects a lot of people, and depending on your age, of course, and maybe if you've had an accident or an issue, joint pain. A lot of people experience this. If you kind of can tell everyone what exactly joint pain is.
So most people with joint pain, we're talking today about arthritis predominantly. These are people who have been living with the pain for a while. Typically, they've been having symptoms for a couple months, and the symptoms tend to gradually escalate over time. The other side of the equation is the people who slip and fall on the ice like this week, and it's more serious and more acute issues. But the chronic issues, the joint pains, the arthritis pains, are what we're talking about today. It typically happens a lot of times in the knees and the hips are probably the most common, sometimes the shoulders as well. But you can get arthritis in any joint. And a lot of times it's due to previous injuries or overuse, or sometimes weight can play an issue in that as well.
Okay, if my mom suffered from some sort of arthritic problem, does that mean my chances are greater because, I mean, are we talking genetics,
disposition? Yeah,
sure.
You know, a little bit more for the hips than for the knees. Most of the time, I mean, the common line is that your genetics kind of make you predisposed to maybe getting a problem, but then some of the things that happen to us throughout our lives, whether it's an injury or a trauma of some kind of tips you over the edge. So the underlying story is that your genetics may kind of load the gun, but your environment may pull the trigger and make you ultimately have knee arthritis or hip arthritis.
At what point do you go to see your doctor to maybe complain about this? Because some people deal with it regardless, and they're like, nah, I'm tough, I can handle it. Yeah. But when should you pick up the phone?
It's when your symptoms get to be interfering with your daily activities, when it really is impacting your life. You know, most people will kind of start off with just some simple home remedies with Aleve or ibuprofens or Motrins and those sort of things, the anti-inflammatories. They'll start with those initially, and that's fine as long as your kidneys are working fine and you don't have any other major medical issues. And so people will start with that, and that can usually buy people some time, maybe a year or two with some relief. And then they'll start trickling into the office with pain that says they're not getting enough comfort from the anti-inflammatories. And oftentimes we can do some non-operative remedies, some shots and some other medications and other things to kind of help them through the process, and maybe buy them a couple more years of time before ultimately the end decision is when to do surgery, which is oftentimes a joint replacement.
And obviously an office visit is going to determine the type of treatment any patient requires. So how do you determine that? I mean, at what point does somebody have to, what's their condition for them to have to go have surgery as opposed to just be treated with medicine?
Sure. So I usually see people for 2 or 3 years before I end up operating on them. So there's a long time there just with non-operative treatment in a lot of situations. And my job is to try to buy people some time and maybe let them live a healthy, productive life, hopefully pain-free, for a while before their arthritis gets to be so severe that the non-operative treatment just doesn't work. And for everybody, it's a little bit different. Some people are a little bit more timid in terms of surgery, and they'll wait it out a little bit longer, and that's perfectly fine. We cater to those people just like people who are, not willing to live with any pain whatsoever, and we'll fix those people sooner than later at times.
All right, let's talk a little bit about the surgical procedure itself. If you can kind of give us an idea of what happens behind the scenes in the operating room.
Yeah. So, I mean, the surgeries, even in the last 4 or 5 years, all surgeons in Nashville would tell you the surgeries has gotten a lot easier on patients. It's amazing, the anesthetic improvements. We do things with regional anesthesia and not as much general anesthetic anymore, which has made the recovery a lot easier for patients. The surgeries have gotten a lot easier in terms of just being able to fine-tune the implants and the techniques. And so overall, it's not the knee and hip replacements that your parents or grandparents may have experienced 10 or 20 years ago. The surgery, people often will have a misconception about what it is to get a replacement. It's not like we're lopping off big pieces of bone and really changing drastically the joint. It's really just removing maybe about 1/4 of an inch of the arthritic surface and replacing it with a metal cap in a knee replacement. It's not cutting off, huge chunks of bone. It's not anything major. It's just kind of shaving off a little bit and putting on some metal caps and resurfacing the worn out joints.
All right. So tell us a little bit about recovery, because obviously, because surgery has come so far, and for doctors, obviously, you know, it's not as intense as it was years ago. You're able to get a patient in and out quicker. So obviously, that might mean a little bit easier recovery for them.
It is typically. In the short period, I mean, I'm doing about 10% of my patients as outpatients these days, which is great, and it's completely patient's choice. If they want to go home the same day, they can. If they want to spend a couple days in the hospital, that's fine too. But it's easier in the sense that patients can get up and get walking an hour or two after surgery. They get, you know, therapy right away these days, and the therapist works with them. And a lot of times you can weight bear and walk on your hip and knee replacements right from the get-go. They're secure and solid so that you can do that. And then, you know, patients just kind of progress along at whatever speed they want to through their hospital stay. Most people are going home these days because their mobility is so much better than it used to be. And then, you know, they just, it takes them about 3 or 4 weeks to kind of get over the majority of the surgery. I tell patients it's kind of like, you know, in the first month or two, your bone has to get used to the new implants. And it's kind of like going to the gym. If you go to the gym and work out really hard, you know, you're sore a day or two later.
Sure.
It's the same thing with a knee replacement or a hip replacement. If you do a lot of activity, you know, 2 or 3 weeks after surgery, you're going to be sore the next day. It's not surprising. Most patients, you know, realize that, yeah, I overdid it yesterday and now I'm sore, but it's very doable. There's not any real restrictions. You kind of get through it and a month or two later, you're getting around well and able to do most of your normal activities.
This is a conversation I know you have to have with your patients, and something that I think makes a lot of people apprehensive about having any kind of procedure in general, but there are risks associated with any kind of procedure. Can you talk as far as joint replacement surgery, what kind of risks somebody might face?
Sure. You know, I think the one that patients and doctors worry probably the most about is infection, which are very rare, you know, usually about 1/4%, so it's extremely infrequent. But that's really one of the ones that kind of people worry about the most. For me, what I worry the most about is falls. Anytime you have a hip or knee replacement, a patient's balance is going to be off for a month or so. It just takes a little while for your body to get used to the implant, and people don't have that recovery. If they slip a little bit, you know, you and I, we would just, you know, stabilize ourselves and we wouldn't fall. But in the early post-operative period, people just don't have that ability to recover from a little slip, and they'll end up falling and hurting themselves. So I caution my patients multiple times, try to take it easy. Don't put yourself in a situation where you might slip, like in the shower or, you know, out on the slippery sidewalks with all the ice we have this week. So just be smart in terms of your footing, and that's what I worry the most about. The other complications we worry about are blood clots, and we put people on blood thinners to prevent that. And with the early recovery and the fast mobility and the blood thinning medicines we use, that's very rare, so it's not a major concern.
All right. As we're winding down our conversation, I'm always curious to know if there's anything people can do to prevent injury from happening. I mean, obviously it depends on, as we age, what's appropriate, but what would you tell people? What kind of advice would you recommend, Dr. Kurtz, when we're working out or when we're, you know, running around with the kids or whatever it might be?
For prevention of arthritis, I think the most important thing is maintaining an appropriate weight and exercising. And if you can pick an exercise that is what we call a closed chain activity, where your foot's staying on a pedal, that's like an exercise bike or elliptical machine or rowing machine, those are ideal because it's low impact, but you can get a good cardio workout. So weight is probably the biggest preventable reason easiest way to prevent arthritis.
All right. Well, one other thing I'm going to quickly ask, since we have a little bit of time. Partial knee surgery, I know, and full knee surgery, is there a big difference?
Yeah, I mean, the knee is actually 3 components, 3 compartments, and you can replace one of those compartments or you can replace all 3 of those compartments. So partial knee replacements, typically you would say that there's a little faster recovery, a little bit more feel to a partial knee replacement because you still have some of your normal bone to kind of give you some sense and feedback. Total knee replacements is, you know, more common by far. It's about 90% of the time, and it's a little bit of a, you know, solves all the problems in the knee. So with a partial knee replacement, you do worry that they may develop arthritis down the road.
All right, had to get that in. Thank you so much for your time, Dr. William Kurtz, talking about joint pain today.
Thank you.